Amy, my name is Corey Feist. I'm the president and co-founder of the Dr. Lorna Breen Heroes Foundation. We were founded in the summer of 2020, and our mission is to improve the well-being of the healthcare workforce, envisioning a future where it is a sign of strength to obtain mental health and other support as healthcare workers.
Corey, it's so nice to meet you. My name is Amy Locke. I'm Chief Wellness Officer at the University of Utah, where I'm also Professor of Family and Preventive Medicine. It's really a pleasure to be here.
Welcome. Thank you for taking time out of your incredibly busy schedule to talk to me today. So if you could just start by telling us a little bit about the grant that you received.
The job of the University of Utah Resiliency Center is really to understand what it means to be human and healthy, but specifically, what does it mean to be healthy as a human who works in healthcare? If we can paint the picture of that for the organization, we can help them create a road to get there. And fundamentally in that is understanding each person's roles and responsibilities as a part of creating that future. The Resiliency Center serves everyone who works on the health sciences and hospitals and clinics campus. And so that is faculty and staff with a primary focus on healthcare workers. And so we do provide direct support to people who experience trauma or experience mental health problems as it relates to working in healthcare. The grant was a tremendous boost to work that we had been doing for quite some time. It allowed us to build out our peer support program and to really think about how to package this material to take to other organizations that are less maybe resourced in this space.
What would you anticipate seeing from the impact on patient care here with the cultural shifts and all of the support mechanisms that you're working so diligently to put in place?
When people come to work and they feel engaged and they feel like, I'm getting so much accomplished and this organization values me and my patients value me, you're a better healthcare provider, you're a better nurse, you're a better physician, and you provide better care.
I'd love to hear a little bit about the progress that you feel like you've seen thus far with the Resiliency Center and in particular these last, I know it's not been a very, very long time, but what progress have you seen so far?
Helping folks understand that culture is not just the way we interact with one another. That is, of course, super important. We treat each other as humans. But also the culture is that we have an agency of change within our organization. And I think that's where I've seen some shift, is in both of those spaces. So a much more willingness to talk about and be vulnerable about the experience of working in healthcare, and to see different groups around the organization really taking this work into their strategic planning and making it a part of what we do as an organization. It's not, well-being is not something just over on the side that it's kind of important, but this is the real work, but that it is the real work. This is how we are successful as an organization.
How have you seen the organization incorporate systems redesign that drive well-being, not just individual support? I'm curious on the systems and the process redesign. How have you seen your efforts through the Resiliency Center take hold and be adopted?
Our program really has 3 jobs. So we think about that individual piece, which for us is providing support for folks who've experienced trauma in healthcare. It's really about culture and helping people understand their role, and it's really about system design. But those first 2 allow the third. The biggest thing for me as I consider this work, nobody thinks that mental health and professional well-being and personal well-being aren't important. No one in healthcare really thinks that's not important. But for many, many administrators and for many physicians and for many nurses, it feels unattainable. And so our job is really to help people understand how we can get to a space where we do consistently think about this, and to think about the creativity and the flexibility and the problem solving that's really going to be necessary to be successful.
It's just got to become part of the fabric, doesn't it? You're now in the inaugural class of Lorna Breen at Grantees. Tell us what that means to you.
Well, it's a great honor, and I think it helps really bring awareness to the organization. It helps bring awareness to the state, to other institutions, and I think it's together we're going to have really the power to change healthcare. I mean, that's what we're doing, right? We're talking about transforming healthcare, which is a big task, And so I think having those foundational pieces and really thinking carefully about how we continue this work in the coming years and decades is going to be essential.